Oral Health Through the Golden Years is presented by Susan Isaac, RDH M.Ed., a recognized national and international speaker in the dental hygiene field.
My name is Susan Isaac, and today I'd like to talk about baby boomers and beyond. Let's get started talking about oral health through the golden years. When we talk about baby boomers, we're actually talking about the generation that were born between 1946 and 1964. Now that is going to have an impact on healthcare in all directions. From 2010 to 2030, 20% of the population will be older than 65. That has implications for dental hygiene and dentistry. These people are aging well and redefining the baby boom or redefining being a senior. These people are healthy, they're in the community, and they're in your dental practice. The difference being is they often have more than one medical condition for you to consider, and they also may be on more than one medication, usually called polypharmacy. So those are some of the challenges of working with people that are over 65 years of age. However, when it comes to working with people over 65 years of age, it's a matter of attitude. It's your belief system about how you should age, and it's also their belief system. Do they believe that as they age, their health will deteriorate? Do they believe that when they get older, they're going to lose their teeth anyway? Do you believe that when people age, that they're going to age in good health? There's a quote from an Oregon Health Science University, the first female head of department of the Ethics and Geriatrics division. And here's what she says: when you hit 50, think as if you're planning for another 50 years. Try something new. Learn a new language. We have another 50 years to consider of living life to the fullest in terms of all over body wellness and psychology, as well in terms of how fit our mind is. And so be open to seniors amazing you. Use your sense of humor. Be yourself with them and have a lot of fun, because seniors are a really interesting group of people to have as friends and as clients. And it's not been well studied, but it's clinically apparent that psychological influence of attitude on health can influence, for example, heart health. And it may be that when it comes to something like heart health, what can be more powerful is how you think about aging than surgery or medicines in some cases. So that's a whole field of study that requires more attention. So when it comes to looking at heart disease, I find that that's a very important place to focus when we talk about seniors, because heart disease remains the #1 cause of death among seniors over age 65, even with all the new medical advancements made over the past 30 years. Fortunately, the medical advances are allowing a higher rate of survival, which means that heart diseases in general is 31.1% of all the chronic diseases of people over 65. And look at the bottom of the pyramid at hypertension, which is the #1 symptom that can lead to heart disease. And it's 49.2% of all chronic diseases of seniors. So it's certainly worthy of our attention to consider looking at heart diseases. When I do a full course on baby boomers and beyond, I talk about how the senses change, osteoporosis, diabetes, many different aspects and medical conditions, as well as how we change dentally as we age as well, and looking at health promotion strategies. But for this particular session and the duration that we have together, I thought it would be good to focus on cardiovascular and cerebrovascular diseases. When I talk about cardiovascular heart diseases, I'm talking about electrical, such as sudden cardiac arrest, vascular, and an example of vascular heart diseases would be myocardial infarction, also called heart attacks, and muscular heart conditions, for example, congestive heart failure and cardiomyopathy. With cerebrovascular diseases, which is a group of brain dysfunctions related to the disease of blood vessels supplying the brain, I would like to focus on stroke, non-hemorrhagic and hemorrhagic strokes, which is part of the cerebrovascular brain dysfunction. So that's what I'm going to focus on for the rest of this presentation. When it comes to looking at supporting a heart healthy lifestyle, we have to focus for a little while on women, because there is a difference between men and women when it comes to heart health. Women, they're actually, and men are different even at a cellular level. For example, women have different proteins in heart cells than men. Their hearts beat faster even during sleep. And unfortunately, heart disease remains the #1 cause of death among women and among women seniors. What are some of the other differences we have to consider as we do our assessment planning, dental hygiene diagnosis, implementation, and evaluation? We have to consider that women are at higher risk of heart disease post-menopause. Well, why is that? One of the reasons is that you have a higher high-density lipoprotein, or the good cholesterol, prior to menopause, because the more estrogen we have, it actually supports a higher high-density lipoprotein. The way that I try to remember high-density lipoproteins versus low-density lipoproteins, high-density lipoproteins you might consider healthy lipoproteins. Low-density lipoproteins, you can kind of think of them as lousy lipoproteins. So the H and the L is one of the ways that I remember the difference. So you have higher high-density lipoproteins prior to menopause, and then you have, as you go into postmenopause and the estrogen levels drop, you have less high-density lipoproteins and possibly higher low-density lipoproteins, and that is contributing to the differences between men and women, or the differences between perimenopausal women and postmenopausal women. So I would like to talk about heart attacks or myocardial infarction. And I've given you a website here on this slide, excellent website for you to go and learn more about all the various heart diseases and the differences between them, and health promotion strategies that correspond to those differences. So when I'm talking about a heart attack, and I'm talking about myocardial infarction, and the reason it's called myocardial infarction is because part of the heart muscle, the myocardium, may literally die during a heart attack. Die meaning infarct, hence myocardial infarction. So that's where the word comes from. A heart attack occurs when one of the coronary arteries becomes severely or totally blocked, and the heart muscle doesn't get enough oxygen-rich blood that it needs, and it will begin to die in various sections of the heart, depending on the severity of the heart attack, and that will dictate the outcome as far as the damage or whether someone dies from a heart attack. After age 70, heart attacks are equally common in men and women. What are some of the differences when it comes to a heart attack or myocardial infarction for senior women? Well, women present with more advanced heart disease in the first place. They receive less aggressive treatment, and several studies document that doctors diagnosed heart disease as stomach origin, depression, or anxiety in women instead of heart disease. It takes longer for women to realize they have a serious problem. So what happens is men and women are not as familiar with the signs and symptoms of heart disease in women and how that differs from men. And so they're coming into the medical practice later than they should, more severe, more difficult for the physician and the surgeon to treat, and therefore higher fatality in that instance. They've also found that women who have a heart attack, because it's not being recognized fast enough by women or the medical profession, have a higher incidence of dying within that first year after a heart attack than men. So the percentage is definitely higher in that area as well. So lots of education is needed for men and women, so that the recognition of the differences is apparent and people get help faster, and the medical profession diagnoses women and their heart diseases faster so they get better treatment as well. So what are some of the differences? Well, here are a few of the differences, and you can see how it would be easier to misdiagnose a woman with heart disease just looking at the signs and the symptoms on the right-hand column compared to men. Men have crushing pain chest, radiating left arm pain, acute symptoms, and it's often after physical exertion. Women may experience chest pain of some type and duration as well, but it's often accompanied by a back or a jaw pain, unusual fatigue, often a couple of weeks before the heart attack, sleep disturbance, shortness of breath, nausea or vomiting, abdominal pain, and sharp angina. So that is the cluster of symptoms that women may be exhibiting and can be looked at differently. As you can see, that cluster of symptoms is representative of a lot of different other conditions as well. Certainly in the dental practice, someone coming in with severe jaw pain, you can certainly do your differential diagnosis, understanding better these differences, and try and look at that as a possibility with a grouping of other symptoms, that you have someone in your chair that is experiencing a heart attack or the symptoms of a heart attack. 25% of seniors don't exhibit any of the traditional symptoms that you see in the left side for males. A lot of the studies, when they were looking at heart attacks for men, were done on men between the ages of about 50 and 75. So when a male gets over 75, they actually need to do more studies to look at, well, what are the symptoms for men over age 70, 75, let's say, and expand those studies, because they're finding senior men, as well as women in general, are not showing the traditional signs that they studied from age 50 to 75 in men. So more work needs to be done in this area. I'm happy to say that when you take your update for CPR, and I just did that in March, that they are talking about the differences in heart attack between men and women, and educating the public in general about the importance of those differences as you go through your CPR training. Another risk factor for heart disease, and looking at the differences between men and women, is looking at diabetes. Look at the difference in risk factor for men versus women. For men, it doubles as a risk factor for men having coronary heart disease, but for women, it's a 4 to 6-fold increase. So women who have diabetes, they are at higher risk for heart disease than men, looking at these differences in the research. So again, another place where we can do differential diagnosis, and we can help educate the client to understand the risks that they are exhibiting and expressing when they come into the dental office, looking at their risk for heart disease. Another cluster of heart diseases that I'd like to look at is cerebrovascular diseases. And that is where you have a group of brain dysfunctions that's caused from a blockage, a clot, or a constriction of a blood vessel or hemorrhage in the brain. And here are some of the symptoms for a stroke, for example, and this is the one I'll focus on of the brain dysfunctions in cerebrovascular diseases. Severe headache, unilateral numbness, blurred vision, loss of balance, confusion, speaking and eating difficulty. It's more effective to treat seniors very aggressively for high blood pressure in terms of trying to help reduce the incidence of stroke in seniors, because hypertension is the #1 symptom for the various heart diseases, cerebrovascular heart diseases, stroke included in that. Now, we have some differences between men and women to consider as well. Again, we need to educate our clients on these differences. There are traditional signs of slurred speech, dizziness, loss of balance, unilateral numbness, and paralysis, which we're all very familiar with. There also are additional signs that women may exhibit. They may exhibit the traditional symptoms, or just a couple of the traditional symptoms, but they also may also be exhibiting the symptoms on the right-hand side, such as headaches and disorientation, pain in the face, arms, or legs, and again, coming to your practice, complaining of pain in the face. Sudden, partial, or whole loss of vision, or double vision as well. And 62% of women had non-traditional signs of stroke. So we definitely need to be aware, and they need to be aware of both sides of this chart. And it's always imperative. This has been known for a long time, and this has not changed. It's absolutely critical to get treatment for a stroke within 60 minutes to prevent permanent and extensive disability. And I can't emphasize that enough, that people understand how important it is to get treatment for a stroke immediately. I talked about hypertension and the fact that it is the #1 symptom that is exhibited as a risk factor for cardiovascular and cerebrovascular diseases. 1 in 3 adults have high blood pressure, and that would be high blood pressure that is over 120/80. So this particular slide that I'm showing right now is a picture of a gentleman looking quite upset. What is he upset about? What he's upset about is that the dentist has just told him that his blood pressure is too high to receive local anesthetic. This particular patient has 4 infected wisdom teeth and needs surgery. So of course he's upset. So certainly I can't emphasize enough the importance of taking blood pressure with all your senior clients on a daily basis. And nowadays, you don't have to ask the stereo to be turned off, everything to be quiet, because having everything quiet in a dental practice is very difficult, so that you can hear the blood pressure as you do the cuff and you do the traditional way of taking blood pressure. With digital blood pressure taking machines, they're accurate. You can take your 6 measurements and eliminate the first and the second measurement in order to get an average that's more accurate. And you can have these devices. They're easy to use in the practice and very, very important for the seniors considering their polypharmacy and various medical conditions, and learning ahead of time what their medical status is when it comes to blood pressure. Here is an example of the new blood pressure classifications. I know you're familiar, but just to remind you that these were published in the Journal of the American Medical Association in 2003, and these are the levels that we follow in dental practice and that we need to educate our patient as following as well. Now, there are links between oral disease, periodontal disease, diseases, for example, and cardiovascular and cerebrovascular diseases, because what can happen is the dental plaque biofilm bacteria and the byproducts, we call them endotoxins, the protease, the collagenase, the endotoxins, the lipopolysaccharides, can enter the sulcular epithelium and allow the biofilm to trigger a cascade of immune response. What this does, it triggers the immune response and creates a hyperstate of inflammation. And that may influence the inflammation that would be evident in the coronary arteries, looking at increasing the possible risk factor for heart disease. Now, in my full course, I go into more detail as to what are the theories looking at the bacterial byproducts in the bacteria and the host response, and how that may play a part in that oral systemic periodontal diseases and heart link. But for now, I'm just going to talk about the fact that we should try our best to decrease the local infective insult in the sulcus and not trigger that inflammatory cascade in relationship to cerebrovascular and cardiovascular diseases. It's all about empowering our clients to change their lifestyle habits and their visitations, more frequent visits to you, for all over body wellness, and also to the physician. When I was 10 years old, I almost drowned. I went down for the 3rd time. I didn't pass out, but I was very disoriented. Because of that, I was afraid to go in deep water, even the end of a pool. When I became 22 years of age, I got tired of not wanting and knowing how to swim and being afraid of water. So what I did, at 22 years of age, I took my beginner swimming badge. And when it was time to pass my test, I did my test with 2 7-year-olds and an 8-year-old. And that poor 7-year-old girl had to do the dead body drag to the edge of the pool with my 22-year-old body. And we all passed the test, and that was a tremendous badge of honor and helped me overcome my fear. I even went further, and 5 years later, I got my scuba diving qualifications because I gained confidence in being in the deep end of a pool and being able to swim, that I was able to do other things like learn how to scuba dive. That empowered me to do a number of things in my 20s because I realized that my fear of water was also holding me back with other achievements in my life just because I lacked some confidence. So it's about empowering your clients to make lifestyle changes in their heart health, because you do make a difference in helping them gain confidence in their knowledge and their ability to make differences and changes in their life so that they can have better all-over heart health. So it's about embracing and gaining confidence and empowering your clients, and you have the ability to do that. So when it comes to looking at improving heart health, here are some of the ways that we can help empower our clients to make a change. That's by helping them have a better attitude. When people don't understand about heart disease or anything else, they're scared. So we can help them to have a more positive attitude. Regular checkups. I hear constantly from my groups, dental hygienists, nudging and nagging, if you will, their clients to go to the doctor and have a checkup because they haven't had one in a long time. And lo and behold, the senior finds out that they do have conditions that require attention, and they come back and they thank the hygienist for being someone who cared enough to nag them and get all of her body wellness and checkups from their doctor. Also, monitoring blood pressure from the dental practice and the medical practice. Good nutrition. We can do nutrition counseling that's very specific to heart health with people at high risk. Encouraging people to have regular exercise. There was one cardiologist I listened to at a pharmacy lecture, and he said, wouldn't it be great, and it might even be more valuable, if people replaced in the medical practice medications with a treadmill. And that exercise is so important. And I've never forgot the cardiologist emphasizing that in that lecture. Also, smoking cessation, ask, advise, refer. We have lots of training, we have lots of resources as hygienists to help people quit and to understand why. And of course, improving oral health with the link between periodontal diseases and cerebrovascular and cardiovascular disease becoming stronger all the time. Better understanding. We don't totally understand the mechanisms, but we're understanding more all the time. We need to help our clients have better oral health in order to have better all-over body wellness. It's about health promotion strategies. The more we learn about anything like heart diseases, the better questions we ask our clients during assessment. We increase that data, allows us to do better dental hygiene diagnosis and implement better health promotion strategies that truly achieve better healthier clinical outcomes. And I can't emphasize enough, evaluate, evaluate, evaluate. Make sure that we're constantly looking at the changes in a senior's life and health. And as I said way back at the beginning of this presentation, be yourself, have fun with seniors, and they'll want to listen to you more, they'll want to laugh with you, and they'll want you to be a part of their all-over body wellness more if you just sit back and relax and enjoy them for who they are. It's time for me to go now, and I want to thank you for your time and attention, for listening to a little bit of information about oral health for baby boomers, all over body wellness for baby boomers and beyond, and heart health in particular. Thank you.
Oral Health Through the Golden Years has been presented by Susan Isaac, RDH MEd, a recognized national and international speaker in the dental hygiene field.